Hi, I'm Dr. Joel Cherdak, president of Houston Regenerative Medicine. Recently, many of our patients have been asking questions about a peptide named GHK-Cu. And the Cu stands for copper, so it's a copper-based peptide that mimics a peptide that your body naturally produces that causes your cells to increase collagen production. So as we get older, the GHK-Cu in our body starts to diminish, and as it starts to diminish, that's when you start to see loss of elasticity in skin, increase in wrinkles, and just general appearances of aging. So by adding GHK-Cu to your peptide regimen, you're going to increase collagen production. And what that's going to do, it's going to increase the quality of your nail growth, it's going to increase hair growth, and it's going to really increase the production of collagen so that your skin has a better appearance, and it'll reduce fine lines and wrinkles, with the effects taking effect fully over the course of about 6 to 8 weeks. And always we recommend patients go on a 6-month course with a 2-month initial course of peptides, then 2 to 4 weeks off, and then another 6 months after that. We also like to combine this peptide with what we call our anti-aging or rejuvenation stack of peptides. So we like to combine it with either a growth hormone stimulating peptide like ipamorelin CJC1295, which will also increase lean muscle mass, increase the quality of sleep, and increase overall well-being and recovery. We also like to combine the GHK-Cu with BPC-157 in certain cases. The BPC-157 increases the elasticity and the smooth muscle mass of your body, so it will help decrease injuries and help your body recover and decrease the aging effects over time. There's also a number of other anti-aging peptides that we can recommend based on each individual patient. So we don't have a one-size-fits-all combination of peptides. Today I just wanted to talk about GHK-Cu because we are getting a lot of questions about that, and we are seeing some significant effects with decreased in the appearance of aging in a lot of the patients that we're prescribing this particular peptide for. So if you have any questions about GHK-Cu or our anti-aging and rejuvenation peptide stack, click on the link at the bottom of the description of this video, and it'll take you to our homepage where you can request a free consultation, and our patient coordinators will answer any questions you have.